Hi, welcome to another episode of Simply Healed, and we have a very practical episode today, right? Welcome, Dr. Jansen again.
Hello, Sean. Hello, everyone. Happy to be here again.
And today we're going to do a more practical topic. It's about cancer imaging. So for those of you who have gone to see your own oncologist or accompany your family members, and the doctor said, okay, look at a tumor here, and you see nothing. Well, tonight we're going to take a whole look at all the different cancer imaging, and Doc will help us learn to see what the doctors see. So tonight's a bit more practical. It's going to be short, and don't forget, after this we'll do our AMA. Ask me anything. You can ask any question. Of course, most viewers will ask us about cancer, what to eat, chemotherapy, immunotherapy, which is the right protocol for you. We will do all that today. All right, Doc. Cancer imaging. Doc, every time when I see MRI scans are okay, but when I see X-rays, I don't see what the doctor sees. I can't tell that you guys can see all that. Yeah. But tonight we're going to go through all the imaging.
Yeah.
So is it going to be easy for our audience to be able to spot what you spot?
Yes. So I'm going to teach you the relatively easier ones. Okay. So you see what the doctors see. Okay. Now, this is also for you guys to understand why the doctor requested this specific type of imaging study. Why CT scan? Why not MRI?
Oh, yes.
Why MRI and why not CT scan? Why just request an X-ray?
We always think go for the most expensive. Those of us
it's most
who are
accurate,
afraid, right?
most sensitive.
But it's not necessary.
It's not necessary because each of these imaging modalities, yes, some may be superior than the others. However, even the more simpler imaging studies like the X-ray would be enough already to diagnose. Okay, so first, speaking of which, X-ray. So X-ray for lung cancer would already be enough to consider suspicion. Alright, so as you can see here in this image, this is a typical chest X-ray.
Yeah.
Okay.
I see a white spot. So for I guess the basic. What's the black spots? What's the white spots?
White spots.
Yeah.
Okay. Now, the white spots are bones. Okay.
Oh, so anything hard becomes white.
Yes.
Anything soft is dark.
Yeah, it's darker.
Darker. All right.
Now, you can see the black ones, right? The pitch black ones.
That's your lungs?
Yeah. Those are your lungs, which
Soft
are
tissue.
aerated lungs. Okay,
Yeah.
so inside that is air. That's why it's black. Okay?
Because it doesn't bounce the radiation.
It doesn't bounce the radiation. It doesn't.
X-ray, right?
Yes, it doesn't attenuate the radiation.
Okay, that's a big word, attenuate.
It doesn't stop. Okay, it doesn't stop the X-ray. So
Alright.
what you are seeing actually in a chest X-ray are shadows.
Shadows.
Yeah. So remember when you're a kid, right? You use a flashlight, then
Yeah.
you
So by here,
shadows.
the shadow is reversed.
Shadows reversed.
The shadows are white instead.
Mhm.
All right. So that makes sense. Cancer tumor is you tell us is hard, right? So it will cast a shadow,
Yes.
a white
shadow.
So
Okay.
yeah, Doc, maybe you can explain to us.
As you can see here, you can see the ribs which are fanning out along the sides. Then below there is a sac-like structure.
Yeah.
That is your heart.
Yeah, I was saying that's not the tumor, right?
Okay.
That's the
That is
heart.
not. Yeah. Yes.
Okay.
So you see the triangular shaped one. You know the spine, right? The spine
Yeah.
is in the middle.
On the right side. Here?
Yes.
This.
On that part, the triangular shaped one is your heart. That is.
Oh, it's so big, the heart.
Yes, that is the.
Oh, it's not
Left
this. It's not this
ventricle.
round thing.
No, it's not the round thing. The round thing is the tumor.
The round thing is the tumor.
Yes.
So so our heart looks nothing like a heart.
Yes.
Yeah.
It actually looks like your fist.
Okay. So that's the heart.
Yes. So that shadow, that part, okay, that is your left atrium.
Okay.
Left atrium above, you see the knob, left atrium, then below is the left ventricle. Okay? Now, adjacent to the left, in between, just above the left ventricle, is a round-shaped tumor. So that is suspicion for lung cancer. Now, of course, just by looking at this X-ray result, we cannot really diagnose the patient that, okay, what you have is lung cancer, because it can also be pneumonia. Okay, it can also be an infection. Now, to know for sure, to distinguish between is it an infection or is it cancer, is to check your history, what you're feeling. If you recently have had fever,
so if you don't have any cough, you didn't have any flu, so it shouldn't be pneumonia.
Yes, it shouldn't be pneumonia.
Then it's worrisome.
Yeah. then it's worrisome.
It's possibly
Probably
cancer. So this is the part that's the tumor.
That's
All right.
the tumor.
Okay.
Okay, so in a chest X-ray, lung cancer looks like this.
All right.
Right. So next, let's go to a more
Bone. Is this bone?
Yes, this is bone. Osteosarcoma. So osteosarcoma, you can look it up in our past video. So osteosarcoma.
Yeah, we
is
did a
just
special on bone cancer.
Yeah. So yeah, osteosarcoma is a bone cancer, more commonly found in kids. Okay. Now, to diagnose osteosarcoma, again, chest X-ray would be enough already.
Just an X-ray.
Just an X-ray would be enough. Now, as you can see here, this is
Yeah,
the
it's
foot.
very obvious.
Okay, this is the foot of a kid. Now, take a look at the bones. Okay,
This
you have
bump
this.
here.
Yes, the bump. That is the osteosarcoma. But however, take a look at the bones, no? The two shafts. Okay, you have the
Yeah.
tibia and the fibula. The fibula is the thicker one going
Okay.
down, and the tibia is the thinner one.
The one on the right.
Okay, so along the tibia, as you can see there, the border of the bone suddenly disrupts.
Yeah,
And it
like a
forms
firework.
firework.
Yes.
Okay, that's the osteosarcoma.
So is that actually bone fragments growing out? It's hard.
Yes, it's bone fragments growing out.
Wow.
However, these are not well developed bones.
So it will
Okay.
look like cartilage if you cut it up.
Yes, if you cut it up,
It's
it
not
will,
smooth.
Yeah, it's not. It won't be smooth. It
Yeah,
won't
because
look
you can
like,
see like it's like fireworks,
Yes.
right?
It won't look like your
Yeah, your
chicken
smooth
bone.
It's
Yeah,
not so
it won't
smooth.
be. So it would be distorted. Okay, so that's your osteosarcoma. Now let's go to CT scan. Okay, so CT scan is usually used on the brain.
Okay.
Then it's also used for the chest, for the abdomen.
What's the main difference between a CT scan and an X-ray?
Okay, an X-ray is a 2D image.
Two
Okay?
dimensions.
2 dimensions.
Flat.
So it's just shadow.
Mm.
Okay? So a CT scan is a 2D image superimposed on one another. Meaning, it is a 2D image casted on top of one another.
Maron, like a crepe cake.
Yes.
If you have ever eaten a crepe cake, right? Like paper moon.
Or
One layer on top of another.
yeah, one layer on top of another. Or it would be like your gardenia bread.
Sliced
Your
bread.
loaf of bread, your sliced bread. So it's like that.
2D images, one on
2D
top of another.
images, one on top of the other. So what do you have? 3D image.
It becomes 3D.
Okay, it becomes 3D. So when you go to the hospital, there can be an option of 3D imaging CT scan. Okay, so the CT scan, the computer can actually create an image, a 3D image, so that it shows where the exact location of the tumors is. However, the 3D image is only shown to patients for educational purposes. The diagnosis, the doctors do not make their diagnosis using the 3D image. The doctors make their diagnosis through this image. This is how the doctors read the CT scan.
Okay.
Okay, it's a 2D image. Okay, they are seeing a cross section of
Yes.
that 2D image. Okay, so this is the brain. This is the normal scan or normal CT scan of a brain. This is brain cancer.
Oh, you can see that spot on the left, right?
So this is how a CT scan is created. Okay, so take a look at this banana.
Magic banana.
Now, this is how you look at a CT scan. So remember, when you go to a CT scan hole, you lie down, right? You lie down. Okay, so imagine this is your head. Oh, okay. Imagine this is your head, and this is your feet. Okay, so you lie down, right? You lie down, and then you go into the CT scan donut, right? Like so. Now, the scan would be how? The scan would be from the top of your head down towards your body. The doctors are actually taking a look at your body like this. Okay? So in your perspective, you would be looking at the patient's body like this. This is the head. Okay, remember, this is the head, this is the head, this is the feet. Okay, so they are looking through the patient like this. Okay, that is the perspective when you take a look at this image. So now, where would your left and right be? Okay, so the right would be the perspective of the patient. So the right would be here. The left would be here. Okay, so when you take a look at this image, the white spot that you see here is the brain tumor. So the brain tumor would be at the right of the brain. Right part of the brain.
I got it from the feet.
From the you're taking a look at the patient from under him, from the feet.
Got it.
All right. So
what can we tell from this tumor?
So from this tumor, of course, this is around at the parietal lobe, no? Parietal around the occipital, parietal lobe. It's around here, no? Now, take a look at the dark spot. So if you have a tumor, that will block the fluid inside the brain from circulating as well. So that can form hydrocephalus, that can form headaches, that can manifest motor and sensory deficits as well. Okay?
Okay. So that's how basically.
Okay, so that's what brain cancer looks like, right? So here's another CT scan of your liver. This is what a normal scan of the liver is. And this is liver cancer.
Oh, where's the tumor?
The tumor,
I can't tell, right?
The tumor is where the red arrows are pointing at.
Okay. All right. Okay.
So you have the liver, relatively.
It's a different color.
Yeah, it's a different color. Usually, liver cancer would tend to have a darker shade of gray. Okay.
All right.
So that is what it looks like. Now, for liver cancer, there is something that we call 4-phase CT scan.
Okay.
Or a CT scan with contrast. Okay. Now, why do we need the contrast? It's to highlight the tumor. Remember, the tumor has its own blood supply.
So you pump something in that can trace it. That will cause it to glow.
That will cause it to glow. Okay. So if it glows upon injecting the dye, then it is most likely a tumor.
Because it has blood supply.
It has blood supply, so most likely it is malignant.
No, you always said that cancer is odd shape. Is that what we tell also?
Yes, it's also odd shape. So as you can see here in the scan, the liver tumor is not a perfect circle.
So if it's, for example, if it's a benign tumor, it usually will be more round.
Yes, usually it will be more round.
Okay, so it's a bit oval, and definitely in picture B, it looks more broken up.
It's quite distorted actually already.
So that's how cancer tumor versus a normal tumor.
Right, so this is a colon.
Normal.
This is your colon, okay? Take a look at the liver. You have your liver above, okay? Then below, a little bit below, you have your large intestine.
Okay, Doc, please circle where the liver is. I have no idea. I'm very bad at anatomy. Okay, so that's where the liver is, all right?
This is where the liver is.
All right.
Okay. Then take a look at the, like the balloon shape, objects.
Okay, we are highlighting it on the image.
Right, that is your colon.
All right.
Okay, so it has a lot of air because there is bacteria. The bacteria are actually generating gas. That's why it has a lot of air.
All right.
Okay, so that's normal. This is what colon cancer looks like.
Okay.
Take a look at the image which is circled. The yellow circles.
Why is this one so dark compared to the first one, the normal? Why this one has lots of lighter gray and this one is so dark?
This is just a different slice. It's a different slice. It's a different cross section.
Yeah, different cross section.
Yes. Right. Okay. So that's why you see a lot of darker areas. Okay. Now take a look at this part of the colon. So this part of the colon is already in the descending colon. Okay. So take a look. Right now, the colon inside there should only be gas. Okay. However, take a look at the grape area. It looks like blocking.
It looks like this part. This part is like a bridge.
Yes.
Separates the two.
That is the tumor.
Okay.
Now take a look at the liver.
Doc, if you didn't explain, all this looks the same to me.
Yes, exactly. Actually, doctors usually have the same issues. They all look alike.
They look alike.
So, okay, here's another thing. This patient actually has a colon cancer stage 4 with liver metastasis. So take a look at the liver.
I see some spots in the liver.
You see some darker spots, right? Those are the metastases. So remember, any tumor that is in the liver, whether it is metastatic or it is from the liver itself, in terms of when you under the CT scan, it would be shader with a darker gray. Okay.
All right, that's interesting.
Right. So here's another scan that we call as a PET CT scan. So PET means positron emission tomography. Okay. So it's a high-tech.
High-tech
CT scan. Now, usually with CT scan, we know the anatomy. We know the location of the tumor, okay, how big it is. However, we do not usually know its function.
Oh,
Is it metabolically active? Okay?
okay.
Because there are benign tumors, right? So, in a PET scan, under the PET scan, the doctors will inject a dye, again, a contrast. Now, this contrast is made out of glucose,
Oh,
sugar.
okay.
Okay?
So let me put it in layman terms. Normal tumors that are benign are not functioning. They're just like a mass, right?
Correct.
But a cancer is actually like a more like a living thing, right? So it has metabolic processes. What that means is it has blood vessels, it's burning energy, there's movement in it, instead of just a clot of flesh,
Yes.
right? So
Yes.
now you insert glucose to see if
If
anything,
it uses the glucose.
if the tumor is using the glucose. So that's a PET scan.
Yes, that's a PET scan.
All
Now,
right.
what do doctors see, no? When they read the PET scan result, this is what they see. Okay, so the dark spots there are where the glucose went into.
Okay.
Right? So take a look at the top, at the head, above, it's shaded super dark.
Yeah.
Because the brain mainly runs on glucose.
Wow.
That's
Okay.
right.
Okay.
Okay, so that's number one. Number two, as we go down, no, the thyroid, you can see the neck part, it is also shaded a little bit darker. The liver is a little bit darker, and then around the intestine, no, and especially at the bottom part where it is super dark. That part is the urinary bladder.
Yeah. So your bladder has a lot of sugar, or what?
Yes, because you pee it out.
Alright.
You
But how
pee
come
out
the
dye.
bones are bright?
The bones are bright because the bones don't usually, the bones are not highly vascular, so they don't use sugar so much.
All
Okay,
right.
so they are just structures.
Okay.
So it would be the same thing with a benign and a malignant tumor. A malignant tumor will use more energy, will use more glucose, so it will uptake more glucose. So in a PET scan, that will look like a dark object. Okay, if it is a benign tumor, then it will look white because it doesn't
because
have
nothing
any
is
uptake.
functioning in there.
Yes.
Okay, let's take a look
Now,
at a cancer.
Let's take a
PET
look at the
scan.
cancer. Now, what we do is we superimpose or we put
Wow.
the PET scan on top of the CT scan, okay, and see if the thing that we saw in the CT scan lights up. Okay, so this is what happens. So this is an example.
So
of
the picture
multiple,
A is that all
this
the
is a
dark
multiple metastasis.
all the dark spots are where the cancer has spread.
Yes, that's bone metastasis.
Wow.
Multiple
okay,
bone metastasis.
Wow, you can
Okay.
see. And so the rib cage here, these are all
Yes.
Cancer tumor.
Yes. Okay.
cancer cells.
Those are all cancer cells. Okay, so that's what
Wow.
it looks like.
Okay.
Okay.
So for those of you out there who your doctor tell you to go for a scan and you don't know, or you've never done a PET scan, now you know why it's so important. It's so clear. It's so clear you can see, right? Wow. And what about B, C, and D?
So B, C, and D just shows you where the tumor is, no?
So this
is-
one lights up.
Yeah, this one lights up. So this is what I'm telling you. A CT scan, okay, then you put the PET scan on top of the CT scan and see if it lights up. Okay? Then, lo and behold, the lighter area, so that is your prostate. So that is prostate cancer.
Okay, so that's why if you do a
Okay.
PET scan, it will come together with a CT scan. All right.
Okay, so that is together. Now,
MRI.
let's go to an MRI. Usually for prostate, the imaging modality of choice would be an MRI. Okay? So this is what a normal prostate looks like under the MRI. Now, what does prostate cancer looks like? So this is what it looks like. So an MRI is it just looks like a CT scan. However, the MRI would have a much higher definition.
It looks clearer.
Yeah, it looks clearer. So here, as you can see, the whole nut-shaped thing here, the whole nut-shaped thing here is the prostate. Now, as you can see,
The darker
the
shade.
arrow, the darker shade, that is where the prostate cancer is.
Wow. After you look at more of these pictures, it becomes easier. But no, Doc, thank you for this particular session. It's quite interesting.
Okay, so yeah, another part of the body that is used that uses MRI, no, is the brain.
So this is a normal brain
It's
scan.
a normal brain scan under the MRI, and this is brain cancer.
Oh, it's
Okay.
so obvious.
It's so obvious, right?
It's so obvious. So
Yeah.
A, B, C, D is it the same brain but different levels?
Yes, it's the same brain. Actually, this is this is the same brain. However, what you see is quite different, right?
Yes.
The you can see picture A, the brain is colored gray,
Yes.
right?
Then B, you see a bright spot.
Then B, you see a bright spot.
Then C, it spreads.
Yes, then C, it spreads. So those are just different MRI modes.
Oh, different modes.
Different
so
modes.
even an MRI, they can like switch resolution or
They can
switch
switch
mode.
resolution. They can invert the pictures to see a more detailed view of where the tumor is and its effect on its surrounding tissue.
Wow. So all of those, all of you who, very common questions. We have people asking us, should I go for the scan? So you can see how useful it is for a doctor. As you can see, it's so different and it's so clear, right? So I hope this encourages those of you who are maybe thinking that you didn't want to spend money on the scan, but it's so important that your doctor who's treating you get a clear picture.
Okay, now let's proceed to the ultrasound. So
ultrasound.
the ultrasound is a little bit more difficult, no? Because ultrasound is operator dependent. So if the operator was not able to catch the tumor, then you won't see the tumor. Okay.
Okay, that's
Right?
important to take note.
That's important to take
Ultrasound is dependent on a person doing the ultrasound on you. If he's not skillful, or he might miss the tumor.
Okay, so where do we commonly use the ultrasound for? Breast cancer. Okay, so here is the ultrasound of the breast. So this is what normal looks like. This is a benign breast mass. Okay, so as you can see here, you see two round dark spots. No?
Yes, two.
Okay, so what is it inside? So that dark spot is filled up with fluid, liquid. It's water.
It's water.
Okay, so water shows up a dark spot under the ultrasound. Okay, however, on the
extreme right,
on the extreme right, the last picture, that is malignant. So you can see the same round spot, no, irregularly shaped. However,
yeah, the shape is even weirder.
The shape is even weirder, and then inside that round oval shape, no, is a more distorted architecture of the mass. So this is malignant. So we call that a complex hyperechoic mass.
Doc, if you had the benign ultrasound result, would the doctor even suggest a biopsy? No. But if you have the malignant one, do you need a biopsy to confirm, or is it pretty obvious that it might already be cancer?
Oh, with just the ultrasound alone, it would already be pretty obvious.
So then would a patient still have to do for biopsy for breast
Yes.
cancer?
You would still have to do biopsy because we need to know the type of breast cancer you have.
Oh, that's true.
To determine the treatment.
Right, there are different types of breast cancer, and if your type of breast cancer is suitable for immunotherapy, you don't even go for chemotherapy.
Yes, correct.
Right, so yeah, okay, so you still need to do your biopsies. All right, okay, that's good.
Now another part of the body that is used. That ultrasound is preferred to take a look at is the ovary. So this is what the normal ovary looks like. Okay, you see the dark spots again.
Yes.
So those are ovarian cysts. Okay, so
that's
those
pretty common for women, right?
Those
Very
are your
common.
egg cells waiting to mature and pop.
Oh,
okay. Okay. So that is quite normal, and this is what an ovarian cancer looks like. Again, inside the ovary is a fluid. It's fluid filled.
Okay.
However, you can take a look at the square, no. You see an irregularly shaped hyperechoic mass there. So it's quite gray with the same color as the surrounding tissues. So that is the mass. Okay, and upon further imaging, okay, if you take a look at it, take a picture, this is what it looks like.
Okay, so you can see it looks abnormal. So that center spot here should actually be pretty clear.
Yeah.
All right. Okay.
So now, just a summary of what we have learned.
All right.
Okay? So for head and neck, the preferred imaging modality would be your CT scan, MRI, and ultrasound, specifically for the thyroid. For the chest, it's X-ray, CT scan, MRI, ultrasound. For breast, for the abdomen, it's CT scan and ultrasound. For the pelvis, okay, it's CT scan, MRI, and ultrasound. For any musculoskeletal structure, that would be your X-ray. For the bones, MRI for the muscles. Okay. For metastasis,
It's the
okay,
PET scan.
it's the PET scan, the bone scan, CT scan, and MRI, which is the best to determine. But preferentially the PET CT scan.
And we saw it just now. Why? You could see the metastasis of the cancer cells all over the body. Wow, Doc. Thank you very much. Well, this is a short course on how to be a radiologist. All right, but I hope today's episode gives you an idea for those of you who your doctor is requesting certain scans and imaging, and now you can see how helpful it is for your doctor. And we want to help our doctors diagnose us as accurately as possible. So without further ado, let's go to our AMA Ask Me Anything segment.